Hello, I'm Dr. Leong. Interstitial lung disease, or ILD in short, is a broad category of lung diseases that affect the interstitium, which is the tissue and space surrounding the air sacs in the lungs. There are many different types of ILD, like idiopathic pulmonary fibrosis, hypersensitivity pneumonitis, autoimmune-related ILD, etc. Interstitial lung disease is a relatively uncommon but an important category of lung disease that can have a significant impact on the quality of life and life expectancy. The common symptoms of ILD include cough, which is usually dry and may persist for weeks or months, shortness of breath of varying degree, fatigue. There may be symptoms related to autoimmune diseases like fever, joint pain, muscle pain, skin lesions, dry mouth, and eyes, and others. Shortness of breath. Shortness of breath may be mild and may only occur during exercise or climbing stairs. In more severe cases of ILD, shortness of breath may occur at rest. Breathlessness is usually progressive, over months to years. At times, shortness of breath is rapidly progressive and fatal within weeks. One can perform a simple self-test known as the 1-minute sit-to-stand test with a pulse oximeter. The normal oxygen saturation at rest is above 95%. A 3% drop during exercise is significant and may be associated with shortness of breath. This is a cartoon showing an alveolus where air is brought very near the blood vessel for gas exchange. So the oxygen from the alveolus passes through the alveolar wall, through the interstitium into the blood vessel, whereas the carbon dioxide comes out from the red blood cell through the interstitium into the alveolus and out. So the gas exchange occurs across the alveolar membrane, the interstitium, and the blood vessel wall. Any abnormality of these three structures will hinder gas exchange. In interstitial lung disease, inflammation of the interstitial tissue and air sacs of the lungs hinder gas exchange. Inflammation is a complex process that involves various cells, chemicals, and signaling molecules in the body that work together to eliminate the stimulus and promote tissue healing. The stimuli which ignite inflammation could be pathogens, allergens, or even one's own immune system. Inflammation is a necessary and normal response of the human immune system. However, pathological, chronic, or excessive inflammation can contribute to the development of diseases. Fibrosis is the formation of excess fibrous connective tissue in an organ, often as a result of inflammation. In interstitial lung disease, fibrosis can occur in the interstitial tissue and air sacs of the lungs, leading to a reduction in gas exchange. In some types of ILD, such as idiopathic pulmonary fibrosis, fibrosis can begin to develop gradually over a period of months or years. Other types of ILD, such as hypersensitivity pneumonitis, fibrosis may occur more rapidly after exposure to an environmental trigger such as bird droppings or moldy hay. Progressive fibrosis in interstitial lung disease refers to the ongoing scarring and hardening of the lung tissues that lead to worsening of lung function over time. In some types of ILD, such as idiopathic pulmonary fibrosis or IPF, progressive fibrosis may begin to develop gradually over a period of months or years. However, ILDs like connective tissue disease-related ILD may progress slowly or rapidly depending on the severity of the underlying disease and the effectiveness of treatment. There are drugs which can retard the progression of fibrosis in ILD. Thank you for your kind attention on this very short presentation on interstitial lung disease. Please subscribe to our channel and turn on the notification bell if you like these brief medical presentations. Bye bye for now.